opportunity on a couple of hot issues. The ongoing battle for healthcare reform, putting that somewhat in the context of the economic situation, and also in talking about healthcare for America Now, talk about some of the ways that healthcare reform can certainly contribute to the road to recovery that the country needs to get on, the immense impact where the healthcare system has failed us all.
So in order to plug the gap by this new revenue fall that we took into account, the governor is using some stimulus money that we'll go into in a second, and is also asking for another $130 million of agency budget cuts, primarily, almost exclusively in terms of the dollar value, education cuts. Almost $100 million to Department of Education and another 25 to Board of Regents, technical schools, other higher education areas. And as I said, the stimulus funds, the governor included about $465 million in what the funds that come through our Medicaid agency, though they don't really have to go to healthcare. They are kind of designed at the federal level to be able to stabilize state Medicaid programs, but it's also the easiest way for the federal government to get money to states.
Cover what's wrong with her. On a private policy, outside of group coverage, her epilepsy is excluded. She's also uprated. They charge her a half again as much as they would a normal person of her age, and yet they won't cover what was wrong with her. There was a brief period where we had her on a private policy, wasn't covering her meds, and her meds were $300 a month, in addition to a $250 per month premium. Now, if it weren't for us, my daughter would have, she were on her own at 21, she wouldn't have had insurance. And that's just the way it would have been. And I'm sure if any of y'all read in the paper the numerous stories about young adults with these problems. And of course, it's not limited to young adults.
HCAN, Healthcare for America Now, is the largest issue campaign in history. Our coalition represents over 30 million people. We have field operations in 42 states, and we have 676 organizational members, 118 national, and 558 state. Our steering committee, and a lot of this information is online, so you can go back and review it at your leisure. But a lot of these organizations you probably recognize on our steering committee: NAACP, MoveOn.org, AFL-CIO, Campaign for Community Change, U.S. Action, so on and so forth. HCAN we have what we call our statement of common purpose, and if you've got some materials over there, you probably got a copy of it. But these core principles are what we believe healthcare reform should be based upon. We believe that there should be a watchdog role in all plans, that health care should be affordable and predictable. The cost of health care should be affordable and predictable to businesses and employers. That people should have a choice of doctors, health providers, and a choice between a public and private plan. After the bill is passed by both the House and the Senate, President Obama is then presented with the legislation to either veto and return to Congress or sign into law. And HCAN is really, really stressing that those principles are in that healthcare reform. If not, then we may mobilize our efforts to encourage him to veto a bill that does not meet all of those principles. And ways to take action. And as I said, Health Care for America Now is very grassroots oriented, and we've seen just through this last election cycle that grassroots is still relevant, is still important, it's not a thing of the past. We have a great opportunity to piggyback on that momentum. Whether you supported McCain or Obama, there was just all this energy, and we want to harness it and use it to our advantage to push health care reform and make it a top priority. So for us, and as Kathy also mentioned, you know, sign up. Please sign on. We have our information over there, or you can give it to me or Brooks, Blanca, Larry. But we want to, you know, we want to add your name in the pot. We want to show that you support healthcare reform. Also donate. We do not accept any money from insurance companies, and that's something that we're very proud of. But you know, it takes money to run an organization like this and to push this through. Contact member of Congress. On our website, we have a tool called Click to Call, and it's very simple. You click this button, you put in your information, and then you get a call back on your phone, and they connect you free of charge to your representative's office in DC. And give them a call. Let them know that this is important to you.